This is Wellspring, presented by Spectrum Health-Zeeland Community Hospital on 99.7 and 1450 WHTC.
And for this Thursday, November the 3rd, our Corewell's Spectrum, get it right now, Corewell Health, Zeeland Hospital, Wellspring program. Our hostess is Sara Donkersloot. Sara, I'll get the name right eventually.
Well, you know what, Gary? I think we all have to think when we say our new name, Corewell Health, formerly known as Spectrum Health-Zeeland Community Hospital. And we are delighted to be with you on Wellspring today. So what do you think of when you hear the word rehab? Many people think of treatment for a physical ailment. While that is true, it's not the only type of rehab services that are offered at Corewell Health, formerly known as Spectrum Health. To provide more information on the different types of rehab is Jason Kooi, Rehab Manager at Zeeland Community Hospital. Good morning, Jason.
Good morning, Sara.
It's a delight to have you. Even though you're on the opposite side of the building, we are joining our folks by Zoom today. So Jason, tell us a little bit about who you are, what is your role and your background?
Well, I am a physical therapist by training. So I have been a physical therapist since 2001. I was a assistant before that. So I think it's getting close to like 29 years I've been doing this work. Most of that's been in outpatient. So think of like outpatient orthopedics. So shoulder pain, neck pain, back pain, a lot of those kinds of common diagnoses. And then I also work part of my time as a supervisor for rehab in Holland, Zeeland, and Grand Haven.
So Jason, I have to ask you, we all have different careers that we can choose. Why did you decide that you wanted to go into rehab services?
I think I would say most people who work in rehab probably would answer this the same, and it's the opportunity to help people. Really, all of our patients that come through the door, there's something about their life that they're not able to do, something they're either need to do or want to do, and they can't. And so being able to help people get back to the life they want, or in those instances where they can't get all the way back to that, teaching them some strategies about how to get back to the best life possible for them.
I mentioned, that there are many types of therapy that Spectrum Health offers. Talk a little bit about that.
Yeah, so, within physical therapy, there's a lot of different specialties. Again, I mentioned that I work in orthopedics. We have therapists that specialize in neurologic problems. We have therapists that specialize in pelvic floor. And then there's also patients or therapists that work in an inpatient setting, like in the hospitals. And I'm sure that I'm missing all kinds of specialties within physical therapy. But then there's also occupational therapy and speech therapy, which I think we're going to go into a little bit more what those are in a minute. But yeah, so really kind of addressing a lot of different issues from orthopedic problems to neurologic problems. Sometimes it's injury, sometimes it's just wear and tear.
Well, and I think that's really interesting what you're saying is because, rehab really encompasses taking care of a person's physical, as you said, when you can help somebody, but there also are emotional, psychological, and, social things that are, maybe affect them. And so really you may be treating a person's physical ailment in your instance, but really you're treating the whole person.
Oh, for sure. I mean, for a patient, they come in with whatever is bothering them. But there is a whole, if I have somebody that has back pain and they can't work and they have bills to pay, or they have a family to take care of, or they want to just sit at a grandkid's basketball game, but they can't sit on a bleacher. I mean, there's definitely like a psychological component to a lot of what we do, for sure.
Well, and thank you for that. And I know I have utilized services by you and your staff. And really, I think it's about taking care of the physical concerns, but also, as you said, there is a lot more associated with it. So We are joined by Jason Kooi, who is a physical therapist, and he's also the manager of physical therapy for the Holland, Zeeland, and Grand Haven offices. It is via Zoom, as I shared, but if you do have a call, you can call 395-1450. That's 395-1450. And Gary will take your call and he will share that with us via the chat. So, Jason, I want to use your expertise in the area of physical therapy. Who would benefit from seeing a physical therapist?
Well, I'm glad you start with the easy one for me first. This is what I do. I would say, really potentially anybody who there's something they want to be doing and they can't. There's something holding them back from doing it. Whether it's again, I mentioned being able to sit on a bleacher, if it's being able to work, if it's being able to rake your yard, like if there's some kind of a pain issue holding you back, I mean, potentially physical therapy can help. I mean, I don't want to oversell. There are certainly things that we have to work with that bigger team of, the physicians, the surgeons and things like that. I think people who have some neurologic issues. I mean, we have therapists who specialize in things like Parkinson's disease, after a stroke, after a brain injury. I mean, there's pelvic floor problems. There's a lot. There's a lot of things that we can help with.
So, people are listening and they may be saying, oh, I really would like to be able to sit at my grandchild's basketball game, without having that pain in the back. Do they need to see a physician first, Jason, to get a referral, or can they connect directly and say, can you evaluate what's going on?
That's not as simple of an answer as what I would like. I mean, legally, we can see anybody in the state of Michigan without a physician referral. However, having your insurance cover that is where it gets a little bit gray. And so, as a general rule, getting that physician referral is always a good idea. Most physicians, if somebody calls and says, "Can I go to physical therapy?" They may want to see them. They may just send a referral over, but that's a whole lot easier than somebody asking for, "Can I have time off work? Can you prescribe me some pain medication?" If somebody's saying, "I want to do PT or OT or speech," any of those, I mean, that's somebody that's being proactive about their health and that really wants to get to the bottom. So I would say safe bet is yes, but certainly if you have questions, you can always call our offices and we can kind of help people walk through what they need.
So, what can someone expect if they would come into your office for a physical therapy visit?
Um, what could they expect? I would say I can speak best for the offices that I work with. Expect to be treated as a family member. We really, we like to laugh with our patients. We like to listen to them, hear stories, but then also making sure along the way that we're getting them where they need to be. Um, I know I've said this a lot when patients come in to see us. A lot of times they don't know what to expect because they've never been to physical therapy or any of the rehab specialties before. And so we really try to work to, meet people at that level to make them comfortable, to make sure that they understand, to answer their questions, so that, a patient that understands what they're doing and why they're doing it is much more likely to buy in and to get better, rather than just be there.
Well, and there is going to be the expectation. Let's say, they have a pain in their back or in their legs, that there may be some homework, right? That they're going to need to go home with some exercises. It's not just coming into the office one week and then the next week coming back. There's some work involved in it.
Oh, for sure. I would say, again, all of our disciplines, we give people home exercises. When you look at things like copays and deductibles, coming in for rehab, there's a lot of times some expense to it. And so if we can give people things to do at home, they can be working on their issues 7 days a week. They can get there faster. They can get there with fewer visits, which is less expense, less out of pocket for them. So home exercises are definitely an important part of what we do.
Okay, so we've talked a little bit about physical therapy. What is occupational therapy? What does it entail and who would benefit from it?
So really, occupational therapy, it's when I think of OT, we'll call it OT. It's getting people back to whatever their occupation was after some kind of an injury. I mean, that could be a physical injury. It could be an injury to the brain, like a stroke or like a brain injury. And what that occupation is can really vary. I mean, if I'm 30 years old and I'm the primary breadwinner of a house, like my occupation is a bricklayer. I mean, that's what I need to get back to. And if I'm retired and I just need to be able to make my meals and get dressed and go shopping and do whatever else that is. I mean, that's your occupation. And so, the OTs really specialize in getting people back to what it is that they really want to be able to do in terms of like activities of daily living or those work tasks. As far as who would benefit, I think about, more in terms of like from a diagnosis standpoint. We have OTs who specialize in that are certified in hand therapy, which is really kind of the whole arm. So think like hand, wrist, elbow, shoulder. So they work much more in like an orthopedic setting, working on those kinds of problems. We have occupational therapists that specialize in neurologic conditions. So again, that's something like after a stroke, a brain injury, spinal cord injuries, things like that. So those are probably the big groups that I think of for OT. And again, it's really around focusing on how do we get people back to what they want to do. And if we can't get them back the way they were before, like what kind of adaptive equipment and what kind of strategies can we teach them?
I think that's a really good point. I recently had a loved one who was in the hospital and, wanted to get back to her home. And, they were talking about, how can we help you safely, get from your bed to your chair, assessing those things, and what types of things do you have in your home, so that, you can be safe. What about rugs? Are those going to be a stumbling block? Let's look at your refrigerator. Where do you need to place things in your refrigerator so you can reach it appropriately? That's what I think of when they're occupational therapists, and that is a component of it, isn't it, Jason?
Yeah, for sure. I mean, safety is a big thing, and we talk about safety all the time within Corewell Health. I'm surprised I said that. I keep saying Spectrum Health, but
Mhm.
safety is a big thing for us as an organization, and I think for us in rehab, safety is a big thing. I mean, really, a lot of what we boil down to, or what we are looking at, is like how do we make people able to do things safely, and it could be safe in terms of a fall or safe just in terms of like not re-injuring something. So yeah, OT is definitely in that home environment. We don't want to see somebody back because they broke a hip because they were reaching too high in a cupboard and didn't have balance or tripped on a rug or yeah. So
Okay, so Jason, now let's talk a little bit about speech therapy. Um, what does this entail? And again, who would benefit from it?
so speech therapists, this is a little bit different. I mean, I think about it from like an orthopedic standpoint. Really, you're looking at um, things like actual talking and swallowing are big ones. They also work a lot on cognition, and cognition is kind of like thinking and processing. After people again have a stroke, or if you know somebody that's had some type of a brain injury, you certainly understand how some of that processing and word finding, those things can be really difficult. So they work a lot on that. And when I think of from a diagnosis standpoint, I was actually talking to one of our speech therapists today, and I was like, "So who is like a good referral? Like, who's a good patient for you to work with?" And she said patients after they've had like head and neck cancers, Parkinson's disease. Again, there's a very specific program that all of our we have therapists in PT, OT, and speech trained in, called the LSVT program. That's works really well for people with Parkinson's. Again, seeing those patients after they've had a stroke and the brain injury are probably the big ones.
Jason, we have a minute left. What would you like to leave with our listeners in regards to their health and, you know, um, really how they could avoid maybe seeing you?
I think the one thing I would say is from a rehab standpoint, we really are trying to work to teach people to be proactive about their health. We're dealing with whatever issue that they come in with, but it's trying to give them the tools, give them the things that they need so they don't need to keep coming back to see us. We really want to partner with them to get them where they need to be. Again, trying to minimize medication reliance and things like that.
And the wonderful thing is that there are offices in Zeeland here at the hospital and at 588 Lakewood and at the Grand Haven Center where we can take care of your needs. Thanks for being here today, Jason. Until next week, Spectrum Health wishes you well.